Hello everyone, myself Dr. Sneha Navre. Today we will be discussing a topic called as case history taking. What is case history taking? It is a professional conversation between a doctor and the patient where the information is exchanged which helps you for the diagnosis and the treatment planning of the patient. Basically, it tells you why the patient has come to you and how you are going to treat the patient. Okay, it is divided into multiple components. The first component is the personal data of the patient. There are subtopics in this personal data. Personal data consists of these many topics. Which one is the first? First is the registration number. Registration number or OPD number, you can call it by any name. It depends on the institution or it also depends upon the clinic. It helps in what? It helps in the billing purpose, for maintenance of the record and also for any medical legal case. Now next is the date. That helps you for the reference of the follow-up, the time of the admission, and it also tells you since when the patient is under the treatment and how is the improvement in their follow-up. Then comes the name. Name creates a very good rapport with the patient. Whenever you call the patient by their name, it creates a bond between the patient and the doctor. So again, it is helpful for maintaining the record too. Then comes the age. Now, as we know, there are the multiple age-related disorders. If the patient is below 12 years, he comes under the pediatric zone. The management in the pediatric changes. The doses of the drugs also changes as compared to the adult. So age-related disorders can be considered. So age should always be asked. Then comes the sex or the gender. Again, there are gender associated disorder. Certain diseases like iron deficiency anemia are more common in the female, whereas you know the marital status by comparing the age. Okay. Then comes the address. Now, when we ask the address, it is for the referencing or to maintain the record. It also helps to know, such as the fluorosis, prevalence of the fluorosis, to know what is the content of the fluoride in the surrounding region, water in the region. There is the occupation. Occupation is the occupational hazards such as silicosis or asbestosis. So occupational hazards. So that's why you have to ask the occupation of the patient. Okay. Which one is the eight? Eight is the marital status of the patient. So whenever patient is married or it is in the reproductive age, you should always ask about the in females mostly you have to ask about the pregnancy and the lactation status.